Typically, the ratio in a not-for-profit hospice is usually a nurse to about 10 or 12 patients. The national statistics are showing us that in some of the for-profit hospices, those ratios are doubled or even tripled, so that one nurse is assigned 20 to 30 patients, and that is impossible to meet the needs of someone who has the severe needs of emotional, physical, and spiritual needs that, facing people who are terminally ill. Under the hospice guidelines, you have to have a terminal illness, so death is foreseeable. Now we have this new concept of care called palliative medicine. Many people under palliative medicine are also terminally ill, but many are not. So there is some confusion over the terms, because when I got my start in hospice, we called it palliative care. Now, in present day, the palliative movement, you don't have to be terminally ill to receive palliative care, and the services are more limited. Patients get much more benefit under traditional hospice care than they do under palliative medicine, and typically it's palliative home care, which is different than hospice. There's hospice at home, and then there's traditional home care, which is where palliative medicine now falls. So it's very confusing. It's very confusing to the average healthcare consumer that doesn't understand the differences. All hospices that are Medicare certified, in other words, they can get reimbursement for their services, they have to follow federal guidelines for hospice. And those federal guidelines started back in the early 80s. And so, it's very clear-cut law as to how we're supposed to be providing care to these folks. However, a lot of agencies who aren't in it for the welfare of the patient have found a lot of loopholes in those guidelines. And so unfortunately, patients don't always get what they're entitled to. There are good for-profit programs, there are good not-for-profit programs, but there is this push nationally for companies to be very profit motivated. Even some of the nonprofit hospices take on the look of a for-profit. So it's just so important that people can educate themselves and look deeper. Don't just accept the recommendation of your physician or your neighbor, research it yourself. I always tell families, if you're having your roof redone, you call 3 people to come in and give you an estimate. But yet when you have a loved one dying, you let anybody in your home. And we've got to start, working to change the thinking of folks so they're not so, gullible or vulnerable in letting anybody in.
I also asked her if there were specific things she recommended a family ask about when needing hospice care.
I think it's looking for a mission statement, it's looking for a list of core values, a list of the federal hospice guidelines. That should be accessible to a patient and a family when they call. You should be offered those things by a hospice program so you know what your entitlements are. Being able to speak directly to anybody inside the hospice, an administrator, anybody, that should always be open to you. And if it isn't, then I would be concerned that if something goes wrong, those people won't be accessible. So and now with the internet, it's easier to do some online research, but some of it looks very good. They talk about quality of life and they talk about comfort care, and it all sounds great, but you have to delve a lot deeper than that. The biggest thing I encourage people to do is to interview 3, sometimes 4 different programs, whether that's call or invite them to the home. But I think you'll know someone's sincerity when you meet them. And I think if you're asking for that list of entitlements and then you don't get it, you'll clearly know that this hospice, wasn't upholding federal law.
The list of Medicare entitlements that Cristen referred to and specific questions to ask when interviewing a hospice agency are included in your workbook. Also, it is important to emphasize that you have the right to consider hospice agencies beyond the referrals provided by your healthcare team. And it is important for family members to know what benefits a patient should receive during hospice and highlights the value of their involvement in the hospice care process.
From the get-go, the family is instrumental in doing the research and the homework before hospice comes into the home. And then from there is just tremendous hands-on care that needs to be given to patients who are terminally ill. So, and that's, again, where hospice, a good hospice program comes into play, is meeting the needs of that caregiver as much as the patient, because it is a 24/7 job for a caregiver. They need as much spiritual direction and guidance, prayer, and sometimes a little physical care themselves. I mean, it's very grueling to care for somebody. The common pitfalls for families, and again, it comes, from not being well educated and not taking time to learn things about end-of-life care. Issues like hydration, lack of nutrition, that scares people because, we feed each other, that's what we do. And so when a patient can no longer eat, they become very concerned. And so they need a lot of education as to, how does it look when someone is declining and how much should they take in, whether it's fluid or food. Issues like sedation and morphine, they're great concerns to families because oftentimes it's those caregivers who are expected to give the medications. So they need to be well educated on how much to give and when to give and why we're giving it in the first place. And to not just accept it, to trust their gut. If they don't think something is right for their loved one, chances are they're correct. And they need to really lean into that and listen. Under home hospice, the way the law is written, it's intermittent services. So we would send nurses, social work, home health aides, lots of counselors in bereavement and spirituality out to the house to interact with the patient and their family. But the patient really must have a caregiver who can be overseeing the care so that they can remain at home.
I also asked Cristen what role the church should play when a member is in hospice.
I think it's important from the church's standpoint to know who those people are. The church needs to back the core values as far as the rights of someone who is terminally ill. And then from there, I think, we've seen churches do it very different over the years. It can be visitation, it can be prayer, meals, things like that caregivers truly embrace. So little things, it's the little things I think a caregiver would say would make the biggest difference to them. The best thing when you hear that someone has been given a terminal diagnosis is to be present. I think, all of us tend to get a little nervous and steer away from that person, but they really need embrace. They need a lot of, they need their space respected in the sense that they have a lot of information that they need to digest and a lot of processing that they're going through facing the end of their life. But it's really having some sort of presence, whether that's via the phone or letters, just letting people know you're available. Oftentimes patients will say nobody comes around anymore. And most patients don't want that. They want to be included. They're still living life even though they've been given a poor prognosis. For every patient it's very different. A lot of these folks have battled illnesses for so long. But for all of them, it is just the worst day ever. To go from treatment-oriented protocols to hearing that there is no treatment at all is just devastating. Devastating for them, devastating for their loved ones, their friends and family.